Hi everyone, I'm Timothy from Heartland Physio, and today I'll be talking about the difference between hip osteoarthritis and hip flexor tendinitis. So, hip osteoarthritis refers to the inflammation of the hip joint. It is an age-related condition where the cartilage around the hip joint wears out, causing inflammation and pain. Whereas hip flexor tendinitis refers to the inflammation of the hip flexor tendons, usually occurring due to the overuse of hip flexor muscles or some trauma-related injury that causes inflammation of the hip flexor tendons. So, how can we differentiate them? Firstly, age might be a factor. Hip flexor tendinitis can occur in people of all ages, whereas it's uncommon for people below the age of 50 to actually suffer from hip osteoarthritis. You can also differentiate the conditions by the symptoms you experience. The location of pain might be different for both conditions. With hip osteoarthritis, the pain might be widespread around the hip. You might feel pain around the groin, the front, the side, or even the back of the hips or the buttock area. Hip flexor tendinitis usually has a more specific location of pain, usually located at the front of the hips and sometimes around the lower back area. Why does pain occur around the lower back area? This is because the primary hip flexor, known as the psoas, actually originates from our spine and attaches to the thigh bone in front, helping you to flex the hip. So, sometimes the pain can actually occur in the lower back area for hip flexor tendinitis as well. Next, people with osteoarthritis tends to get pain more often in a standing position when they are putting weight through the hips. Whereas hip flexor tendinitis can cause pain even in a lying position when you have to activate your hip flexor muscles. Lastly, an increase in hip movement when suffering from hip osteoarthritis can actually reduce pain and stiffness. This is because with movement, it can help to lubricate the fluids in the joint, reducing pain and stiffness. Pain can, however, increase with a lot of movement when suffering from hip flexor tendinitis, and this can be due to overuse of the hip flexor muscles. So, a simple solution for people with hip osteoarthritis is to move in a comfortable and pain-free manner, usually when lying down. It can do you some good if you are suffering from hip flexor tendinitis to rest from activities that might overwork the hip flexors. I hope this helps you in differentiating between hip flexor tendinitis and hip osteoarthritis. Cheers!